Hello, friends. Welcome to Nurture Nursing. The topic for today's discussion will be based on the current emerging issue, which is often left unrecognized, which is post intensive care syndrome. Introduction. We as healthcare professionals generally focus more on short term goals for critical care patients. It was discovered in recent studies that these patients do not return to their former level of function for weeks, months, and even years. Critical care survivors develop cognitive, physical, or mental disability after prolonged admission in an intensive care unit. Who all can develop post intensive care syndrome? Patients, family members, and even children are at risk to develop post intensive care syndrome. Moving on to the definition, post intensive care syndrome is defined as a new or worsening impairment in physical, which is usually seen as ICU acquired neuromuscular weaknesses, cognitive impairment, which mainly affects thinking and judgment, or mental health status arising from critical illness and persisting beyond discharge from an acute care setting. Post-intensive care syndrome for the family members refers to the acute or chronic psychological effects of the critical illness among members of the family during critical illness as well as after discharge from an ICU. Phases of critical illness. There are four phases. First one is acute illness phase. Here the patient is admitted in ICU and is on continuous monitoring. The time frame for this phase is days to weeks. Whereas the second phase is hospital recovery phase, and here the patient is admitted in ward and are planned for discharge. Here the time frame is days to weeks. The third phase is early post-discharge recovery. Here in this phase, the patient can develop post-intensive care syndrome if the patient and relatives are not given proper health education. And its time frame for this phase is months. And the fourth phase is late post-discharge recovery. Here the patient is at home, and even after years of ICU admission, the patient can develop post-intensive care syndrome. Moving on to the incidence, there are three main impairment which are cognitive, physical, and psychological impairment. Based on the study conducted in 2016, cognitive impairment was found to be 25%, whereas physical impairment was more than 25% and psychological impairment was found to be 62%. The risk factors for post-intensive care syndrome can be classified into three types. Cognitive impairment. Based on that, if the patient has been admitted in an ICU and has been diagnosed to have delirium, if there is any acute brain dysfunction due to stroke or alcohol intoxication, hypoxia due to acute respiratory distress syndrome or cardiac arrest, and hypotension, which can be due to sepsis or trauma, and any renal replacement therapy like dialysis and respiratory failure can lead to cognitive impairment in these patients. Psychological impairment, the female gender itself increases the risk for development of post-intensive care syndrome, and use of sedation, usually high dose, can lead to post-intensive care syndrome. Physical impairment, prolonged use of mechanical ventilation, and sepsis, multiple organ dysfunction syndrome, and prolonged duration of sedation can lead to physical impairment. The risk factors for post-intensive care syndrome development in family members are female gender, and if the relatives are of younger age, and if the patient age itself is either less than 18 years or above 60 years of age, then the risk is high, and lower educational level of the family members. If their loved one like spouse is admitted in ICU, then the risk of the other person is high, and if they have more comorbidities like hypertension, diabetes, or any other cardiovascular disorders can lead to post intensive care syndrome, and if they have any known history of mental illness, then the risk for post intensive care syndrome is high. Pathophysiology. First one is physical impairment. These patients usually develop intensive care unit acquired weakness. It refers to acute muscle weakness of the extremities in a symmetric pattern, and it can be classified into critical illness polyneuropathy, where the nerves are usually damaged. It is characterized by a symmetric distal sensory motor axonal nerves affecting limbs and respiratory muscles. So these both will be affected in CIP. The second one is critical illness myopathy, where the limb and the respiratory muscle weakness is seen with retained sensory function. Here the muscles are damaged. In critical illness neuromyopathy, both muscles and nerves are damaged. Moving on to the fourth one, muscle deconditioning. Here they have diminished ability to perform daily activities. The incidence of ICU acquired weakness is 40%, and among all of these, critical illness polyneuropathy is commonly seen in patients. There are three main reasons or mechanisms for the development of ICU acquired weakness. First one is microvascular or macrovascular ischemia. Reduced oxygen supply and nutrient delivery to the nerve axon, which can be due to hypotension or a vasodilation, which further leads to impaired mitochondrial oxygen utilization and ATP generation, thereby leading to nerve ischemia. Whereas in catabolism, there is increased breakdown and decreased synthesis of muscle protein, which can lead to muscle wasting. Whereas in immobilization, there is a increased muscle mass reduction, which leads to muscle wasting. All of the above leads to nerve ischemia. Here the nerves are deprived of oxygen, and thereby the mitochondria are injured, which leads to ICU acquired weakness. Second one is cognitive impairment. Here the neuroinflammation plays a major role in decreasing the cognitive performance. It is purely a manifestation of brain dysfunction. It involves impaired memory, language, attention, and visual and spatial abilities. Delirium, dementia, depression increases the risk for cognitive development. Mental or psychological impairment. It involves depression, anxiety, and post-traumatic stress disorder, which is a condition that is triggered by a terrifying event, either when the patient experiencing it or witnessing it. These might increase the risk for development of post-traumatic post-intensive care syndrome. A small recap of post-intensive care syndrome. Psychological impairment involves anxiety, depression, and sleep disorders, whereas cognitive impairment involves memory difficulties, concentration difficulties, and slowed mental processing. The third one is physical impairment, which leads to weakness and balance problem. and neuromuscular impairment and breathing problem because the respiratory muscles are affected. Clinical manifestations of post-intensive care syndrome. They might have generalized weakness, fatigue, decreased mobility, sexual dysfunction, sleep disturbances, memory disturbances, and poor concentration. For the family members, they can develop sleep deprivation, anxiety, depression, and complicated grief. Complicated grief refers to the grief that has been for a longer period of time, and it is usually a painful emotion due to a loss that doesn't improve with time, and here the patients are unable to resume with the normal routine activity. And post-traumatic stress disorder. The management involves elimination or correction of causative factors like hypoglycemia, hypotension, and sepsis. Appropriate administration of sedatives. Administering sedatives only if they are required, and using mild sedation might help. Reduction or elimination of environmental stress like noise reduction and reducing the environmental stimuli. Frequent patient and family communication. This can be done through counseling. Maintain ICU diary. A diary is maintained to note down the progress in the health condition of the patient as well as the health educations that are given for the patient and relative and the investigations that are done for the patient. And the care that is provided is usually noted in ICU diary and post ICU clinics. It involves referring these patients to appropriate units and having regular follow up. Physiotherapy and occupational therapy and rehabilitation therapy is given mainly to revert back to their normal life. The prevention involves ABCDEFGH bundle. A stands for awakening, use of light or minimal sedation, and breathing involves spontaneous breathing trials. The patients are weaned off as early as possible. Coordination of care and communication. The patient and the family members are involved in the care that is provided and are provided with adequate information before doing and after completion of any procedure. Delirium monitoring, assessment, and management. Delirium is usually assessed in these patients with the help of CAM ICU-2, which refers to Confusion Assessment Method ICU-2. And early ambulation is usually recommended for these patients. Family and follow-up referrals are given for the patient and relatives mainly to assess for development of post-intensive care syndrome. Good communication is required mainly to discuss with the patients and the relative regarding the care that is provided in their own language by providing a calm environment, and handout materials has to be given to the both patients and relatives to understand the health education in an appropriate way. Management involves implementation of ABCDEFGH bundle addressing the patient needs, mainly sleep hygiene. Here the patients are asked to perform minimal exercise before going to bed, and they are asked to take hot shower or hot milk prior to bedtime, and they are asked to avoid taking carbonated or caffeinated beverages after 6 p.m. They should avoid they should avoid having heavy meals at the dinner time, and they should take dinner at least 2 hours from bedtime, and they should follow a regular sleep pattern for maintaining good sleep, and they should also avoid using electronic gadgets at the bedtime, and family involvement plays a major role in improving the emotional health of these individuals and providing information for both family members and patients might reduce the stress level and increase a sense of bonding between the healthcare professionals and patients. Noise reduction devices like earplugs and headphones can be suggested for these patients, and eye masks can be suggested to reduce the environmental stimuli, and music therapy, which generally involves in reducing pain and increased relaxation and decreases the stress and promotes better sleep. And adequate energy and protein intake is essential. According to ESPEN in 2019, the energy requirement is 20 to 25 kilocalories per kg per day, and protein requirement is 1.3 grams per kg per day. So, talking about the key aspects of teaching that has to be given for these critical care survivors. So, before discharge, the nurse has to check on these key aspects. So, first one is pharmacy. So, we should try to avoid or remove all the inappropriate medications in the patient container and adjust and monitor the new medications, and we should also teach them how to monitor the blood pressure, and then we should make sure that these patients are vaccinated prior to discharge. Vaccines like pneumococcal vaccines and influenza vaccines are generally recommended for these patients, and use of durable medical equipments like oxygen, wheelchair, walker and braces can be suggested for these patients, and referrals for various departments like cardiology, pulmonary department and nephrology and neurology can be given opinion for these patients, and rehabilitation therapy can be involved like exercise, nutrition, physical therapy, speech therapy, mainly to screen these patients for their return to work. And improving health habits involves mainly teaching them about smoking cessation and avoiding substance abuse and avoid use of alcohol. And once if the patient are diagnosed with cognitive impairment, then speech therapy, language therapy, cognitive therapy, rehabilitation is given for these patients. Then if the patients develop mental health problems, then they are assessed for anxiety, depression and post traumatic stress disorder. So here the treatment is mainly based on the targeted treatment. So these are the references. If in case you have any doubts, you can ask me in the comment box. It would be nice if you give your valuable suggestions for future. Thank you. If you like my video, please do like, share and comment. Thank you. After seeing the video, please do try to complete the quiz, for which the link is given in the description box. Thank you.